Hi everyone, we're getting ready for another fun TLN webinar today. And today, we're going to be talking with Ellen Abbey-Johnson from AllOne Health back again, but this time to talk to us a little bit about implicit bias and the assumptions and how to address them. With that, I'll hand it over to Ellen.
Thank you, DJ. Good morning, everyone. Like DJ said, my name is Ellen. I am with your Employee Assistance Program, AllOne Health. Hopefully, that name sounds familiar to you, but if not, that is essentially a well-being benefit that you all have access to. So, I am a licensed clinical social worker, and I kind of wear a lot of different hats at AllOne Health. I'm, of course, on our team of trainers. I am also one of our clinicians, so you could come see me for some individual sessions. I also oversee our clinical operations as well as head our Backing the Badge program for our first responders. So there's a lot of different spaces you might see me in, but I always enjoy being able to meet with a group to share content, have discussion. Really, my hope is that this can be a discussion and that you pull something from today's hour together that feels applicable to your space. And the best way for that to happen is through engagement. So if there are questions, if there are comments, please feel free. Utilize the chat, unmute, raise a hand. I will do my best to monitor those throughout. I'm going to be honest, I'm not always the best at all the things. You'll probably notice I look to the right a lot. That's because that's where you all are on my screen. So I'm used to presenting to faces, right? Not my slides. So if you notice me looking that way, that's what I'm peeking over at. So don't be shy. Feel free to unmute. That might be the best way to get my attention. But like I said, I'll do my best to monitor that chat as well. So today we're talking through implicit bias, and this can be a topic that we might have a lot of ideas about what that means or how that might show up. For a lot of individuals, it can also bring up a little bit of discomfort. We might not feel like we always have the language to discuss some of these areas, or the topic of bias can feel daunting, or how do I talk about it in a way that feels professional or appropriate, particularly in the workspace. And so I say that to say, today's training, we really want to create a safe space. We want to be able to engage in conversation and questions. And really kind of talk about this idea of this implicit bias where we all have them. Right? We're not assigning any kind of negative, this means you're a bad person, or anything like that. We're talking about, man, this is something that is unconscious, that we all have to work through. And ideally, we're all always a work in progress. In all aspects of life, but including this one of how do we catch our assumptions? How do we address those, not just in the moment, but moving forward for our betterment and growth as well. So just keep that in mind as we move throughout today's presentation. So really, we're going to talk about kind of understanding what is implicit bias. How might that show up? We're going to talk about how that then impacts our decision making and behavior. Right? Our thoughts, our feelings are all connected with our behaviors and our actions. So if our implicit bias is starting in our subconscious thinking, if we don't check it, it has a way of coming out in our decision making and our behavior. We're going to talk through what that might look like in the workplace, how we might see some impacts. How do we minimize bias, right? How do we catch some of these things so that way it doesn't get to the point of impacting decision making, particularly in the workplace around policy, practice, or any action items. And then we're going to talk about what can we all do as individuals. Again, as I mentioned, ideally, we're all always a work in progress. So what can we each do as individuals to continue to grow and learn in some of these areas? I'm going to provide, some ways that we can do that. So first, I said I love engagement, so I'm going to throw out a question first. What comes to mind when you think about bias or you hear the word bias? Feel free, unmute, use the chat, whatever you're most comfortable with.
And keep in mind, if you drop it in the chat, I'm happy to read it out loud. I'm seeing judgment,
Judgment. Mm-hmm.
perceived connotations. Oop, hold
Mm-hmm.
on. Perceived con no, or perceived notions about someone or something or someone. Racism, economic.
Yeah, those are great ones. Yeah, we have kind of this idea that we've maybe already created about something or about somebody,
Predisposition,
predisposition. All right. Racism. Yeah, absolutely.
assumption, looks like is in there too.
Assumptions. Yeah, yeah, absolutely. Stigma. That's a
Hmm.
good one. Yeah, so I'm noticing in all of these, there's kind of this undertone um, of negativity, right? That we have these preconceived notions about someone or something that may or may not be accurate. Judgment. Um, Most of us probably wouldn't want to be identified as somebody who casts judgment on individuals, right? Um, Assumptions. We all know what they say about assumptions, right? Or assuming. Um, we tend to be off, right? Stigma, something that kind of gets in the way of progress, right? Racism. We have all these kind of negative connotations around bias that immediately it feels negative or feels like maybe something that maybe unintentional or feels unfair and feels personal at times. Um, you might think of stereotypes. You might think of moments where you have felt judged or you have felt misunderstood. There's lots of different things that can come to mind, but really, I post this because, and I want you to notice what came up for you, whether you put that in the chat or it's just something that you're thinking, because bias isn't just an abstract concept. Sometimes it can feel that way, right? It can feel very difficult. Again, it tends to be something that's challenging to discuss. We can kind of fumble through what does that mean? How does it show up? There's different types of biases. We're only going to address one today. So there's a lot of different parts and pieces to this, but ultimately, this shows up in real experiences for us as humans. Um, and so you might think of some of those situations or recall a situation where either you felt on the end of that misunderstanding and you felt misunderstood, or maybe in hindsight, you catch yourself, man, yeah, I made the assumption. Um, I made an assumption about someone else based on limited information, and in hindsight, maybe I wish I would have handled that differently. Um, Again, we're all human, we're all flawed. I hope all of us can kind of think back into hindsight because the reality is humans hurt each other at times, and the thing that we're trying to increase here is our awareness of how do we have awareness so that we can learn from those experiences and do better moving forward. Uh, and so, just as these initial thoughts are surfacing, just kind of keeping that in mind. What comes to mind, and reflect on that as we kind of go deeper through some of these pieces, and maybe some of what initially comes to mind feels, yeah, this feels really in alignment with what we're talking about. Or maybe our mindset shifts a little bit as we move throughout today's presentation. So we're going to start. I don't love the pretest title, but just some questions again to think about. I won't make anybody kind of throw out answers here, but just think to yourself, can we ever fully eliminate bias? Completely get rid of that. Can we think of a way to address bias in the workplace, or maybe a way that you feel your workplace has addressed bias? Have we maybe experienced a time where bias has caused equity challenges in the workplace? We maybe think of some examples. And then true or false, implicit bias is an involuntary process rooted in our unconscious. So again, these are just some questions to be thinking through. We're going to kind of address some of these, but I would imagine that as we move through these questions, there's probably some thoughts coming to mind, right? We probably have some ideas on what it would look like to address bias. I'm sure that everybody can think of some examples of where they've seen bias lead to equity challenges. And maybe our ideas on how to address that have come out of those lived experiences or those examples. It's again just something to be thinking about. So we're going to look at some of these assumptions. And again, please keep in mind, I'm sharing this out of we all do this. But I think this is something that can really get us thinking that, man, we make a lot of snap judgments throughout our days. And oftentimes we're not even realizing that we're doing it, right? So we think about some assumptions that might come up. Marriage status. What does being married say about somebody or not say about somebody? Sometimes, well, if you're married, that means you're more stable. Is that a fair assumption always? Sometimes marriage status we link to age, right? I have a young face, and I hope that serves me well moving forward in life. And I would get asked all the time how old I am in a professional setting, which doesn't feel like a very professional question, right? But it was something that I would get asked often. When I started wearing my wedding ring, overnight I stopped getting that question. Did it change my appearance in any way or change my age in any way? Absolutely not. But I went from probably receiving that question on an average of about maybe every month to I can't tell you the last time I was asked that question. Right? Again, we make assumptions. What does that mean? Race and ethnicity, we draw conclusions. Children, does somebody have them? Do they not? How many children does somebody have? What might that say about them? How does somebody choose to parent their children, right? All of these assumptions that we tend to draw. Religion, what religion somebody chooses to engage with. If they do practice or have a religious practice, what might that say about them? My husband is a chaplain at the Children's Hospital, and if somebody doesn't know him and they hear what he does, they very quickly make assumptions here in West Michigan around what that means about his religion and his spiritual practices, even though there's chaplains of all different faith backgrounds and practices. They very quickly make assumptions about what that means of his beliefs, his background. They either apologize for swearing or don't swear until he does, and then they're like, oh, okay. Right, so we make assumptions based on this limited information that we have about somebody. Maybe we think about somebody who practices a religion outside of our own or one that we are not as familiar with. Do we take that opportunity to educate ourselves, or do we make assumptions based on limited information of what that might mean? somebody's travel experience, somebody's professional background. If we have a new team member, maybe it's a career change. Do we maybe have some questions? Do we maybe make some assumptions about what that means or what they bring to the table? Somebody's hobbies, what they do or don't like. We can make snap judgments on how somebody chooses to spend their time, how somebody chooses to spend their money, right, with hobbies. If we think, hey, is this going to be something that bonds us, or is this going to be something that we think, oh, maybe we're not going to be so close, or maybe we have some differences here, right? All of these, and we could probably think of other examples, right, of where we make these snap judgments based on very limited information, and we draw lines or conclusions. Where sometimes when we get to know the person, we think, oh, that actually didn't make sense at all, right? Now knowing them. But we're all guilty of that, and that is because we're constantly assessing for threats. Now, threat sounds really extreme, but we're talking about this from a brain survival mode perspective, right? Our brain can't really decipher between perceived threats and actual threats. And it runs very much on a survival mode and instincts if we are not working in some of these areas, right? So if we look at a threat, we often identify before there's any behavior. So if we think about, is this situation threatening? Is this person threatening? Oftentimes, our brain, whether it's conscious or subconscious, is going through that before there's any behavior tangibly for us to assess. We're relying on perceptions and assumptions. What bias often does is it links there's a difference to that means it's a threat. Now, logically, when we're all sitting here having this conversation, we think, well, no, Ellen, right? Difference doesn't have to mean danger, or difference doesn't have to mean threat. Correct, 100%. And I would hope that, having a conversation, we're outside of a scenario, we can all identify that. But when we are in the moment, when our brain's operating at this subconscious level, those are the lines the brain is drawing, right? Difference puts me on edge. Maybe I wouldn't say danger. Maybe I'm not going to let it affect my behavior, but maybe I feel a little unsettled. I don't feel quite right. Right? Our brain signaling, something feels off. When it goes unchecked, that's when the perceived threat then dictates maybe our tone, or there can be an escalation. If we're already under stress or pressure, it can intensify our bias. If we're being asked to make a snap judgment decision, we're relying less on finding the facts and evidence, less about behavior. We are relying more on those perceptions and assumptions. And then ideally, we're moving to awareness and reframing. How do we pause so that we do give time to find facts, separate facts from assumptions, to challenge ourselves to say, well, do I have evidence to support that assumption or to support that thought? Or is there a way here that I'm maybe assuming? So we want to focus on the actual behavior and not the bias. But again, that's going to take time to do that, right? Sometimes we have the time, and sometimes we might feel like we don't. So we're making those snap decisions. Again, this is in no way saying, well, yeah, this is the purpose that it serves. This is talking about from a biological perspective, what our brain is doing and where we want to train our brain to move to. So we have control over our decision making and our contexts by increasing our awareness and challenging some of those snap decisions or assumptions. So just some definitions here. So what really is implicit bias? I'll give us kind of a working definition for today. So implicit bias really is it's our unconscious attitudes or stereotypes that influence how we understand people and make decisions automatically. We make the decisions automatically. We're they're not necessarily deliberate in intent or awareness. Now, one thing that I think is very important for us to address here, intent does not matter when we have caused harm. So while these biases, from the implicit bias perspective, again, there's many types of biases. We're just focusing on implicit today. In implicit bias, this happens in our subconscious. It is an unconscious response, removes that intent and that awareness often. That doesn't make the behavior less impactful or harmful. So that's why it's still important for us to talk about it and to be addressing these things and where we can rework some of these parts of our brain to be able to catch that, right? Because we can't just say, oh, well, it happened unconsciously, not not on me. Uh, no, we still have an obligation to be working on ourselves. We have an obligation to acknowledge when we have caused harm or hurt, and where we can do better. So these biases often develop over time as our brain learns patterns, and our brain's learning patterns from a lot of different perspectives. So the culture around us and that we are exposed to, our upbringing, uh, social media and other forms of media, right? What's the messaging that we are always bombarded with, right? Feels hard to get away from. Any past experiences. So our brain's taking in all of this information, and that's what it uses to inform these snap judgments and assumptions. So they operate underneath our conscious awareness, but they certainly shape our perceptions and our actions. Um, and they might even contradict the values that we would say that we hold, right? We might say, no, I believe or my values are very different. Um, However, we might still have some of that subconscious kind of programming happening that contradicts. And oftentimes when that happens, it's very uncomfortable for us. We struggle with how to remedy, right? Why was that my response? That's not what I actually believe. And that can be something that we as individuals really have to work through and remedy. This isn't in alignment with who I am, or what's important to me. And so how do I find more alignment here? So this is important because, again, it goes to that we all have these. Even when we would say, I'm somebody that cares about fairness and justice and equity, we are not exempt from implicit bias. And so that's an important kind of reckoning to come to terms with. If we think about, we might say, yeah, absolutely. I believe in fairness and equity in the hiring process for, gender equity. And then in conversations, maybe we catch ourselves assuming a doctor is a male or assuming the nurse is female. What pronouns do we gravitate to when we don't know? Does that maybe demonstrate some of our underlying assumptions that can come from, again, our past experience, our upbringing, the culture that has been around us, right? Historically, physicians has been a male-dominated field, correct? That's changing. But does our subconscious still kick in with some of those assumptions? That might not be a case where we're directly causing harm, right? Maybe we're talking with somebody and, they're talking about a medical appointment and we're assuming that the physician's a male, or we use a he pronoun. Um, Maybe that doesn't cause any harm, but something to take notice of, right? Where do I fill in these gaps? Or do I say I believe in some of that equity, but do I maybe question some female-driven leadership a little bit more than maybe I would a male leader? Language that might be used, right? Whether that's is the individual an assertive leader or an aggressive leader? Do we notice the difference in the words we use based on the individual's gender, based on the individual's race? Are we assigning different language, right? Those are all kind of examples where we might say our beliefs are in alignment in one way, but when we're speaking or when we're thinking about different things, maybe some other messages come up for us, and when we have to kind of reconcile some of that. Now, where did this come from? Again, this is all talking about the brain. This is in no way saying, again, that this is the past. Absolutely not. This is a how do we understand where this comes from so that we can better work with it, right? And have an understanding of what's helpful. So, because our brain operates very much in that survival, trying to keep us alive, right? It's doing its best. Sometimes we just have to help it along, though, right? Sometimes its best isn't the best, right? Because it's operating on limited information. There's a lot that our brain does that's incredible. There's a lot that our brain can't decipher between. Again, perceived threat, real threat, same response. So when we think about this, this is because we have this survival instinct that came from a time where society looked very different, and the threats that we faced looked very different. And you might not have had time while you were out hunting to ponder, well, is that really, a lion, or am I a good, or is that really right? Our brain's making snap decisions because perceived threat, real threat, we're going to operate based on how are we going to survive regardless. So our brain made these snap judgments. It creates those pathways. The shortcuts helped us survive. Now, there is a time where it really was survival. Now, not so much. And that's where we have to help our brain along. But there's so much information coming at us at all times in any given space. We process a lot of it unconsciously. Because the reality is, we just simply cannot process everything that we have coming our way in today's day and age. If you think about the number, just think about your workspace. I don't know what each of your workspaces looks like, but I know at any given time, I've got my emails going off, I got Teams messages going off. Maybe I'm in a meeting and then I've got texts going off on my personal phone. Maybe I got somebody calling my personal phone. Right? Splits attention everywhere. And then we think about outside of work, well, we're still carrying around our phone with 1,000,001 distractions and messages every day. I'm still accessible to most people in my life 24/7. We go out, there's lots of sounds, there's lots of stimulus, right? There's a ton of things coming at us at any given moment. And it's not just the things that might be around our little bubble, it's citywide, statewide, nationally, globally, right? We have access to levels of information that we were not intended to really absorb. So if we think about this from a numbers perspective, we can consciously process about 40 bits per second. Not nearly what we have coming in terms of the environment, the lights, the sounds. Think about all of our senses and how overloaded they can get at times. Anybody ever just say it by the end of the day, like just nobody talk to me or look at me even, right? Like, we all just need a sensory break. So that means we're outsourcing 99.9% of the received information to our unconscious. So we think, I don't even have time to fully process that. But even that decision we're not making consciously, right? What we're choosing to really actively process and what we're choosing not to, those are just automatic responses that are happening. And so, really, this is where the implicit bias lives because the unconscious mind steps in and is filtering this data. And then the implicit bias has a way of that's where it lives, that's where it operates. It's making those quick decisions and it's helping us. How do we simplify? How do we prioritize? Uh, and in some ways, that can be helpful, and in other ways, not so much. Um, so we've got to look at while this filtering keeps us functioning, because if we tried to process all this information, we couldn't function. Uh, it can also lead to errors when assumptions or those shortcuts go unchecked. And so that's where we've got to look at, okay, are there times where I'm not checking some of this? Or maybe I'm overlooking. So if we think about a work context, I'm going to give an example. Let's say you're going through a hiring process. And in most situations, when you're going through a hiring process, you want to get through it quickly, right? It's already can be a long process. We don't really want to drag it out anymore. Most of the time, we're hiring because we really need somebody. Sometimes that urgency can then lead to this information overload. We're sifting through things quickly. There's a lot coming at us. And if a manager doesn't check that, are we risking some maybe subconscious favor of certain candidates? Do we gravitate towards the individual who maybe fits the usual molds or is more similar to us, right? Similarities, again, differences. Sometimes if our brain goes unchecked, difference is a threat instead of difference is what we need to have a difference of ideas and opinions and to really have a flourishing workspace. But again, if it goes unchecked, we tend to gravitate more towards likeness and similarities. That feels more safe to the brain. And that can lead to overlooking really creative ideas. And well, now we've kind of maybe we've overlooked some of our best candidates. Again, all unconsciously, but the outcome is the same. Right. So if we're not checking and slowing down, that's where we really want to, oh, sorry, I don't know why my slides did that. That's why we really want to slow down. We want to look at, okay, we have so much coming in, but we still want to decide what's important and what we're prioritizing and how do we do that in a way that can help check some of these assumptions that might come into play. Or maybe it's some stereotypes or prejudice that come into play, right? These are things that can also live within implicit bias and within the unconscious parts of our brain. Sometimes when we think about these areas, they can feel very overt. They can feel very like, how can this possibly be something that's happening unconsciously? Again, this is where I would say there are different types of biases. And are there certainly examples of where these are fully living out in the open, fully aware and conscious? Absolutely. For the sake of today and how it operates with an implicit bias, we're going to talk about how this shows up in our unconscious mind. So stereotypes, this is when we kind of take this Maybe it's accepted broadly, maybe it's not, but this believed or oversimplified generalization about a group of individuals. So we lump individuals together. Prejudice is when we take that stereotype and now we believe it's true and universal. So now we start to apply it. Now the discrimination goes to now I've taken that belief and I'm applying it to my actions. That's the unjust, the unequal treatment based on categories like race, gender, age, appearance. We could make a very long list of ways that unfortunately humans have othered each other. Um, so, stereotype we think about, that's maybe the oversimplification or a generalization about a group. The prejudice is, well, now I believe that that's true. And the discrimination is based on that belief, I now act upon it and how I treat individuals within that group. Uh, so when we look at these areas, this is where we want to catch ourselves in looking at, are there stereotypes that whether I would logically or consciously say I agree with or not, are there some of these that maybe still play out, right? That still come to mind or that I hold. Ideally, that's where we want to catch them, right? What are the stereotypes that we're exposed to? Are we challenging those or are we just kind of moving on or are we accepting those? Ideally, we catch it before it moves to, well, now I believe it and now it's going to impact my actions. So implicit bias really happens when the stereotype informs the behavior. I've now taken that generalization, I've applied it to how I'm going to treat this individual. Again, this is involuntary, no less harmful. Oftentimes, this can happen subtly, which sometimes for the individual on that receiving end of the mistreatment can make it difficult because we might feel that, we might know that something is off, but it can make it difficult to pinpoint. Or you might be somebody who, man, I've seen that we might hear the term microaggressions, these things that happen. And unfortunately, for marginalized communities, oftentimes it's, I'm used to it, I can pick it up quite quickly, and I can name it. It's rooted in that subconscious and developed through the lifespan, whether that's direct messaging or indirect messaging. So we know that through experience, through upbringing, we receive all of these messages. That's what's informing really these stereotypes, and then what translates into those actions. We know that this can be elevated in certain stressful situations. So if we find ourselves in high stress, and maybe a situation where there's a hard decision to be made, we operate a little bit more subconsciously in those moments, right? When our stress signals flare, our logical brain isn't firing as much as the emotion or survival parts of our brain. Well, where does our implicit bias live? We're in the survival part of our brain, not so much in our logic problem solving part of our brain. So we find ourselves in situations where it's hard for that logic piece to be firing. We can easily fall back on some of those unchecked narratives or unchecked stereotypes. Anytime there's questionable information, our brain does not like gaps. So we often fill them in. We are filling them in with assumptions. If we have questionable information or limited information, the reality is sometimes we just don't know, but we don't like that. And so we fill that, and we can fill that in a way that is not helpful. Uh, and I would say not even just not helpful, but harmful to either the individual or the situation at hand. Anytime there's distractions, again, we think about that concept of we have a million and one things coming at us. If we're adding in distractions, we'll now have even less time to be filtering what's happening or what's coming at me. Right? I've got one more thing coming in. So am I really taking time to look at my beliefs, my actions, my decision making? Uh, if my phone's going off, or uh, I've got a kiddo crying, or I've got a fire I'm trying to put out at the office. Uh, Probably not, right? Probably not the most conducive space for some decision making that can have real impact um, for other individuals, for a team, for ourselves. Uh, so I bring these up just to bring awareness to. If we find ourselves in some of these, it can be a really good time to try to check where is some of my thinking coming from? Where is some of my decision making coming from? Am I maybe operating too much on autopilot in a way that's not helpful? So the way that that can play out in the workplace, if this goes unchecked, going back to that example of a manager that's overloaded and is in the hiring process, if we are not careful, we fall back on what is familiar. What that can lead to is a lack of diversity in our workforce. And that can have massive implications, right? That means we're not opening the doors for other ideas. We're not opening the doors for other perspectives. It lessens our creative abilities and innovation as a team. Um, and so that impacts the entire culture, right? And when we see that start to play out, right, when I asked that question at the beginning today of examples of where there's been equity challenges in the workplace, those examples directly impact our feelings towards our work environment. That directly impacts our culture, the way we view our work, the way we view our team, the way we view leadership. Uh, it directly impacts that culture. And then if it really goes unchecked, uh, it can also lead to discriminatory treatment and practices. Right? If we don't check ourselves in some areas, it has the way of, well, now what are we okaying? What have we accepted? And sometimes without realizing it, man, now it's become a practice. And did we even realize that that's happened? Uh, that points to our psychological safety in the workplace, right? Do I feel safe here? Do I feel safe not just safe to be, but do I feel safe to be myself? Do I feel safe to engage? Do I feel safe to bring ideas forth? Um, and so we really want to be cautious of how are we putting into practice some of these ideas unintentionally, even. Again, unintentionally is still harmful. And where might we need to check some of those practices? So, just that overview, it exists and operates unconsciously, it influences our decision making. Any stress or ambiguity is going to heighten that, right? Um, and interventions matter. So, the thing here that's important is while bias exists and bias is human, it's also flexible, meaning that we have an obligation to look at this and we have the opportunity to make changes, right? This is not, well, this is informed by my upbringing or in my experience, and so that is what it is. We are all responsible for our own healing as adults in our personal life, in our professional life, and of our growing. And so, uh, knowing that this is something that is we can adjust. We can learn. If we look at that in a work context, that might be, if we're looking at a leadership facing, that might be, we're going to look at some policies and revise some policies and practices that maybe just don't make sense. And we've got to look at here. We've got to challenge, why was this put into place? What purpose is it serving? And are we still okay with that as an organization? And we talk about it from a team member perspective, looking inward, what can I do? Again, this is human, this impacts all of us. What can I do to better myself in how I show up in the workplace and how I show up in my day to day? How am I catching my own bias? And one of the ways that we do that is being aware of our thoughts and our behaviors, especially in times of stress, but I would say across the board, looking at what are some of my thoughts in some of these areas, right? Do we even know? Do we even stop to think, right? Maybe after today's presentation, what you take from it is maybe I've got to sit with some of this. Maybe I have to sit to see, are there some stereotypes that sit or linger? Um, or maybe I want to be a little bit more aware of my thoughts. Listen, I love a good people watch. The mall, great place for it. Man, what thoughts come up when I'm observing others in the public space? What thoughts come up when I'm navigating a challenging situation with my colleagues? Um, and then how do I act out of that? Are there ways that I act out of that that maybe need to be addressed and looked at? And the other thing that is so imperative that we're doing is that we're listening to one another. When we talk about bias, we talk about assumptions, oftentimes it's because we don't have information, and then our brain fills it in with incorrect information. So, how am I taking opportunities to listen? If I'm having challenges with a member of my team, where do I seek understanding rather than I just want to be heard or I just want to move on or I want to confirm what I feel I know is true? Right? How do we leave the door open to, well, maybe we're wrong sometimes, and we've got to leave the door open to that. And so, not just hearing, but truly listening to one another, uh, listening to understand, and really practicing some of that where an individual feels heard, creating that safe place and protecting time to have those conversations if we feel that they're necessary, right? If we're thinking about, man, yeah, I've had some challenges with a colleague and I really had to look at that. How do we protect time to invest in that collegial relationship in a way that, okay, I want to make this individual feel heard. I want to better understand. Um, I want to create a safe place. Or maybe we have to practice this when somebody comes to us and says, hey, when you said X, Y, and Z, that was really hurtful. Which one is a really difficult thing to come and bring to a colleague? Two, it's a really difficult thing to receive. But it's also so important for repair because, again, we're all human. We're going to make mistakes. And my hope would be that we all would want to know, right? Would want to do better. And so, how can we have these conversations of not jumping to, well, that's not what I meant. That's not what I intended. Intent does not matter when we've caused harm. Jumping to, I need to hear this individual and really hear them. How do we create a safe place for that conversation? How do I not jump to assumptions even in that moment? Making sure we're not distracted, right? And really have some of those difficult conversations that can come from addressing or looking at something like implicit bias. Because the opportunities may come. And so I would just encourage everyone, be mindful of opportunities. to learn both on the receiving end of that conversation, but are there ways that um, maybe you've been hurt and you're looking at how do I even attempt to have that conversation, which can feel so incredibly daunting. And really, when we're looking at some of this, the thing I want to hit here is we are each in charge of our own growth and learning. So, if in reflecting, we think about, man, what are some of those knee-jerk reactions or assumptions or stereotypes that maybe come to mind? We are responsible for our growth and our learning, or maybe some of our unlearning that has to happen in order to really check our implicit bias. And so look for opportunities to do that. That could be maybe that's conversations with the mental health professional of just, I have to reconcile some of this because it feels so outside of who I am as a person and who my values are. And that's really challenging. And that can be a great opportunity to wrestle with some of those questions in a safe environment. That might look like going out and investigating some new learning opportunities in reading and research. So put in some of that work. Look for books that you wouldn't typically gravitate to, or authors that maybe are different than you would typically gravitate towards. Seek some of that growth, and not just in one-on-one conversations with individuals that we know, but in a way that we're putting in the work to do some of that learning. But with that said, there's still the importance of interaction, right? Contact alone can help dissolve bias, right? And so putting ourselves in environments where, yeah, maybe sometimes, maybe it is a little uncomfortable. Maybe we don't feel like we have the best understanding. Maybe the idea of investigating somebody else's religious practice does feel a little uncomfortable. Uh, but are there ways that that might be important to us and to our relationship with that individual? So just thinking about how do we have contact in a way that is positive, is uplifting, is a safe place, and one that checks any of our assumptions. And part of that is we want to see individuals, not groups. Uh, we want to see the person for the person that they are, and not parts of a category that we can place the individual in. Again, humans are very good at othering each other, unfortunately. But how do we set that aside to, I want to see the individual, and for who they are as a person. Perfect. Thank you so much for letting me know. Appreciate it in the chat. Just wanted to make sure we didn't have a question, so that's why I'm pausing here. So just in wrapping up, now we're gonna go back to these questions. Again, I should change the word test. That's my mistake. Not a test, but just these questions of, can you ever eliminate bias? And I'm hoping that through today's presentation, we kind of come to, well, not necessarily eliminate, right? This is something that's happening unconsciously. This is something that is informed. This is something that speaks to our split-second survival brain pathways. Just because we can't eliminate it doesn't mean that we cannot work on it, though, right? We can lessen impact. We can examine the stereotypes and the thoughts before it moves to the belief and the action stage. That's what we can do. In addressing bias in the workplace, again, I think you can probably all think of examples of what that might look like or what that has looked like in your workspace. Is that examining new policies? Is that the conversations that we have with our team members? Is that having conversations around accessibility in the workplace, both for colleagues and for members of the public that you serve. What does that look like? We know that bias can cause equity challenges in the workplace. Again, I think we can all think of examples of things that we have seen or we have experienced. Um, and we know that, yes, implicit bias is involuntary. It's rooted in our unconscious. That is true. But again, no less harmful or hurtful, and still something that we have opportunities to expand our knowledge on and adjust some of our thinking patterns that then influence how we interact with each other. So, I just want to leave you with, this idea of, what kind of came up for you today as we're talking about this. Again, this can be a really uncomfortable conversation. And it's really hard work to examine some of these things. Um, and it can feel daunting. And so, but it's so incredibly important. And so, you don't have to do all of that alone. Keep in mind you have access to the Employee Assistance Program. That can be a great place to connect with a mental health professional if you maybe want to talk through some of the things that might have come up. Um, or, maybe this is something that you want to sit with, digest. Maybe it increases your awareness of what comes up for you when you're engaging with somebody of a different background, a different faith practice. Um, Maybe it's something that increases your awareness when you're, doing some good old people watching at the mall and thinking, man, what comes up? What comes up, and how do I really examine my thinking to where I can curb it more towards a benefit of the doubt or a positive spin versus what's easiest for us to go to, which would be the negative. Right? How do we examine some of those pieces to turn that around? Any questions that anybody has from today's session?
And again, I'm happy to read the questions in the chat. I know we're close to time, but I want to make sure everyone has a chance to answer questions.
Mhm.
I do have one question, Ellen. Um, how do you approach when someone has maybe a implicit bias, and
Mhm.
that implicit bias isn't just against another group, it's against themselves as well.
Oh, like you're saying they might hold that bias, but they would also be a part of that group.
Correct.
That's a great one. So the tricky thing with that is everybody's kind of on a different journey of how they identify, right? And I would focus on if we feel like that conversation needs to happen from this caused some hurt, or maybe this wasn't appropriate in the workplace. I would focus on that piece and bring that up in a hopefully, private, no distraction. I would bring this up out of a, I was sitting with this for some time, and I felt that it was important that we had this conversation, even though it can be difficult when X, Y, and Z was said. That this is how I felt, or this is how I interpreted it. And I just want to make sure, moving forward, those kind of statements, aren't cannot be made, they lead to some unsafety, whatever that might be, right? Why ever we felt like this was really important that we bring up, that we kind of talk through those pieces. I would leave the self-exploring of how they are part of that group for that individual, right? Of, you know, I'm not quite sure why that came up. I don't need to know, right? And hopefully they put in that work to try to better understand why that statement or why that hurtful comment came up, and they can do some of that exploring on their own. But yeah, that's a great question.
Great. Thanks, Ellen.
Yeah, absolutely.
I'm seeing some thanks in the chat as well. Um, but any last minute questions, feel free to unmute or drop it in the chat if you like. With that, I'll say thank you, Ellen, for your time today. And also, if you ever have a question that maybe you want to ask offline, feel free. You can always let me know, and I'm happy to pass Ellen's contact over to you. Or you can reach out to AllOne Health in general. Everyone there is very great resources.
Yeah, absolutely. If there's any questions, feel free to pass them my way. I would be happy to continue the conversation, but really appreciate everybody joining today uh, and participating.
All right. Well, thanks everyone.
Great.
Take care.
Thanks so much.